And begin. Hello, my name is Levi. I'm going to be a nurse today. I'm going to be conducting a head-to-toe assessment on you, and it's going to involve some palpating and inspection. Is that all right?
Yes.
I'm going to be conducting hand hygiene for 20 seconds. Can I get your name and date of birth, please?
Todd Bayangas, date of birth 11/14/1994.
All right. Can I see your wristband? Okay. Everything. I'm going to check for the MAR, and everything checks out. I'm going to make sure this is 20 seconds, and I'm going to raise you to my working height. All right. Raise it to my working height and put on my gloves. I'm going to be putting patient privacy. All right. To get started, I'm going to be looking at the patient's head. It appears to be normal cephalic and sitting upright at the midline of the patient's body. There's no evidence of micro or macrocephaly. Is it all right if I palpate your head?
Yes.
All right. Do you feel any pain or tenderness?
No.
You're going to look at the back of your head. All right. There's no evidence of pain, tenderness, lesions, masses, or parasites or vesiculations. Excoriations. All right. Now I'm going to be looking at the patient's hair. It appears to be black, straight, thick, and well kept, and evenly distributed throughout. No evidence of alopecia or hair loss. Now I'm going to be looking at the patient's face. It appears to be the patient appears to have a pleasant and neutral expression. The features are appropriate for the size of the patient's head. There's no evidence of tics or vesiculations or acromegaly. All right, it is symmetrical bilaterally, and now I'm going to be looking at I'm going to ask you to raise your eyebrows, wrinkle your forehead, frown, smile without teeth, smile with teeth, puff out your cheeks, purse your lips, and whistle. Cranial nerve 7 is intact. Looking at the patient's eyes, the outer canthus is aligned with the pinna of the patient's ears. The palpebral membrane is symmetrical bilaterally and free of discharge, drainage, debris, inflammation, styes, or chalazions. There's no evidence of ptosis. Looking at the patient's eyebrows and eyelashes, they are evenly distributed throughout, no evidence of hair loss, and the eyelashes are pointed out and away from the patient's eyes. I'm going to test your conjunctiva now. All right. Conjunctiva are pink and moist. Sclera are white, appropriate for the patient's skin color. The irises are brown, round, and consistent throughout. The corneas are clear and transparent and smooth. All right, now I'm going to be testing your corneal light reflex. Look at the wall in the distance for me, please. All right. All right. Corneal light reflex presents symmetrically in both eyes. Now I'm going to test your 6 cardinal fields of gaze. Please follow my pen light with your eyes. Don't move your head. All right. All right. Patient demonstrated extraocular movement smoothly without evidence of nystagmus. Cranial nerves 3, 4, and 6 are intact. Now I'm going to be testing your pupillary response. Please just look at the wall in the distance. All right. Patient's pupils constrict in direct light and consensually. Now look at the wall in the distance. Shift your focus to my pen light. Follow it. All right. Patient's pupils dilate when looking at in the distance and constrict and converge when looking at something close by. All right. Now I'm going to be looking at the patient's ears. They appear to be consistent in color with the rest of the patient's body. No evidence of swelling or drainage. Please tell me if you feel any pain as I palpate your tragus, auricles, and mastoid processes. All right. No nodules, lesions, masses, or pain on outer ear when pressure is applied on the tragus. All right. Now I'm going to be conducting the whisper test. Please cover this ear and repeat whatever you hear me say. Patient was able to repeat 2-syllable word whispered 2 feet away from patient's ear. Cranial nerve 8 is intact. Now I'm going to ask you to turn your head to the side as I conduct the otoscopic exam. I'm going to pull the patient's ears up and back. So I look at the patient's ear canal. It is appropriate in color and cerumen for the patient's skin color. There is no evidence of inflammation, excess cerumen, or lesions. Looking at the patient's tympanic membrane, it is pearly gray and slightly transparent, it is slightly concave, with the umbo present and visible. The cone of light presents at 5 o'clock towards the patient's nose, no evidence of perforation or swelling. Alright, now looking at the patient's nares, it appears at the midline of the patient's face. No evidence of discharge, malformation, misalignment. Looking at the patient's inside the patient's nose, no nasal polyps, lesions, septum deviation, or perforation. Now I'm going to palpate. Please let me know if you feel any pain or tenderness.
No pain.
All right, no evidence of pain, tenderness, crepitus, or disalignment in the patient's nose. Looking at the patient's lips, they appear to be pink and moist. The vermilion border is intact without cracks or lesions. There is without cracks or lesions. I'm going to ask you to open your mouth as I stick this tongue blade in your mouth. Looking at the patient's tonsils, they are visible at a grade of +1. The mucosal lining is pink and moist. Now I'm going to ask you to say ah when I put your tongue blade down, okay? Say ah. All right. On intonation, the uvula retracts and rises symmetrically bilaterally. Cranial nerve 10 is intact. Now I'm going to test your tongue's range of motion. Please stick out your tongue. Point it up towards your nose, down, side to side. Patient demonstrates full range of motion in patient's tongue. Now I'm going to test your neck. Please look up as far as you can go, down as far as you can go, ear to shoulder as far as it'll go, other side, rotate as far as it'll go, other side. Patient demonstrates full range of motion in patient's neck. Now shrug your shoulders against resistance. All right, turn your head against resistance, other side. All right, patient demonstrates 5 of 5 strength in neck and shoulders, no evidence. Cranial nerve 11 is intact. Now I'm going to test your upper body. Extremities, I'm going to ask you to hold your hands out. Looking at the patient's nails, they are pink, smooth, and rounded with an angle of less than 160 degrees. No evidence of cyanosis or clubbing. Now I'm going to be checking the capillary refill. On pressure, it blanches. Upon release, capillary refill occurs instantly. Now I'm going to be testing your skin trigger. Upon release, skin retracts instantly, no evidence of tensing. Now I'm going to test your radial pulses. Hold your hands out. Radial pulses are equal bilaterally at a grade of +2. The rhythm is regular, with a regular rhythm and a rate between 60 and 100 beats per minute. Now I'm going to test your range of motion. Please open your and close, or extend and flex your arms. All right. Now make a box with your wrists. Close it. Close the box. Open the box. Throw open the box. Now with your fingers, close the box. Open the box. Throw open the box. All right. Do you feel any pain or tenderness? No. Patient demonstrated full range of motion in elbows, wrists, and fingers without pain or tenderness or crepitus. Now I'm going to test your strength. Put your arms up like this. Push. All right. Pull. Down. Up. Down. All right. Hands out. Try to open against resistance. All right. Now grasp my fingers as hard as you can. All right. Patient demonstrated 5 out of 5 strength in upper body extremities. Now I'm going to test your cerebellar function. Could you hold your fingers up? Touch your nose alternatingly as fast as you can with your eyes closed. You can stop. Open your eyes. Now touch your nose and my finger as fast as you can. Other finger. All right. Now fingers to thumbs as fast as you can. Now pat your hands on your knees up and down as fast as you can. All right. Patient demonstrated full upper body fine motor coordination and function. No evidence of cerebellar dysfunction. All right. Now I'm going to check your I'm going to be checking your posterior thorax. All right. Looking at the posterior thorax, the color is consistent with the rest of the patient's body. The posterior thorax is symmetrical bilaterally with the ribs sloping down at an angle of 45 degrees. All right. When I tell you to, please breathe in and out as I auscultate your posterior thorax, your lungs. All right. Breathe in, out, 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 in, out. All right, now fold your arms forward. Please breathe in, out, in, out, in, out, in, out, in, out, in, out, in, and out. Breath sounds were clear, with mostly vesicular breath sounds with some bronchovesicular sounds towards the middle. Now I'm going to be no evidence of adventitious breath sounds such as rhonchi, crackles, wheezes, or pleural friction rubs. Okay. Now I'm going to be testing the patient's anterior thorax. The color is consistent with the rest of the patient's body. Ribs slope down at a 45-degree angle. Coastal angle is 90 degrees. It is symmetrical bilaterally. The anterior-posterior diameter is about half the lateral diameter. No evidence of barrel chesting, pectus carinatum, or excavatum. All right, looking at the patient's breathing, the patient demonstrates eutonic breathing at a regular rate and rhythm between 12 and 20 breaths per minute. No evidence of accessory muscle use or intercostal retraction. Now I'm going to be auscultating for anterior breath sounds. All right, breathe in, breathe out, breathe in, out, in, out, in, out, in, out, in, out, in, out, in, out. All right, no adventitious breathing with mostly vesicular breath sounds. All right, now I'm going to be checking your heart. Color is consistent with the rest of the patient's body, no visible pulsations, lesions, or masses. Now I'm going to be palpating your PMI. PMI is present at the fifth intercostal space at the left midclavicular line. No evidence of heaves or thrills. All right. Now I'm going to be auscultating your cardiac landmarks with the diaphragm of my stethoscope. All right, at the aortic valve on the second intercostal space, at the sternal border, I hear the S2 sounds. At the pulmonic valve at the second intercostal space, at the sternal border, I hear S2 sounds. At Erb's point, third intercostal space, I hear no friction rubs. No heart murmurs. All right, now at the fourth intercostal space, at the tricuspid valve, I hear S1. At the mitral valve, fifth intercostal space, midclavicular line on the left side, I hear S1. All right, using the bell of my diaphragm. On the aortic valve, I hear no S3 or extra heart sounds. At the pulmonic valve, I hear no S3. At Erb's point, I hear no cardiac friction rubs or heart murmurs. At the tricuspid valve, I hear no S4. At the mitral valve, I hear no S4. I'm going to ask you to lie down now. All right. Looking at the patient's abdomen, I'm going to divide it into 4 quadrants. I'm going to divide it into 4 quadrants at the midline and at the umbilicus, using that as the origin. The patient's the contour is flat. There is no visible masses or venous dilations, dilated venous patterns. All right, now I'm going to be auscultating with the bell of my stethoscope in all 4 quadrants. I'm going to be auscultating for 5 to 30 seconds in each quadrant. I hear intermittent, high-pitched, normal, active bowel gurgling. I do not hear any venous rubs, venous hums, bruits, or borborygmi. Now I'm going to be percussing in all 4 regions. All All right. I heard tympany all throughout, except for on the liver border where I heard dullness. Now I'm going to be palpating lightly. Please tell me if you feel any pain or tenderness.
No pain.
All right. Any pain or tenderness?
No.
All right. No pain, tenderness, masses, or enlarged organs. Now I'm going to be deeply palpating. All right. Did you feel any pain or tenderness?
No pain and tenderness.
All right. No pain, tenderness, masses, or enlarged organs found. All right. Now I'm going to ask you to sit up. As I assess the patient's lower extremities. All right. The color is consistent with the rest of the patient's body. The hair distribution is even throughout. No evidence of pallor, rubor, cyanosis, lesions, or dilated venous patterns. Looking at the patient's toenails, they are pink, smooth, and rounded with a angle of less than 160 degrees. There's no evidence of clubbing or cyanosis. All right. On pressure, they blanch. Upon release, capillary refill occurs instantly. Now I'm going to be assessing the pulses. The posterior tibial pulse is even bilaterally with a grade of +2. Now the dorsalis pedis pulse is even bilaterally with a grade of +2. All right. Now I'm going to be testing your cerebellar function. I'm going to lower the bed all the way to the ground, and I'm going to ask you to tap your feet as fast as you can. All right, now I'm going to ask you to run your the heel of your foot down the shin of the other foot, other side. Now I'm going to ask you to make a figure of 8 in each foot. All right, patient demonstrates. Patient demonstrates full lower extremity fine motor function and coordination. No evidence of cerebellar dysfunction. Now I'm going to test your patellar deep tendon reflex. All right, patient demonstrated deep tendon reflex is present at a grade of a +2. Now I'm going to, the bed is already lowered, and I'm going to ask you to stand up, turn around, and bend forward just a little bit. All right. See if you are visible. Okay, I'm going to be palpating the patient's spine. The vertebrae are all straight. And perpendicular to the shoulders and the hips, which are parallel to each other. No evidence of scoliosis, lordosis, or kyphosis. Now I'm going to ask you to reach down and touch your toes. All right, now bend backwards as far as you can go. All right, now bend side to side at your hips as far as you can go. All right, now rotate side to side at your hips as far as you can go. The patient demonstrates full range of motion in the patient's spine. Now I'm going to ask you to walk over there. Yep, now with a heel to toe gait, I'm going to ask you to walk back. Okay, now I'm going to ask you to face me and close your eyes and stand on one foot for 20 seconds. After the 20 seconds are up, I'm going to ask you to open your eyes and hop on one foot. Okay, you can sit down now. That concludes patient demonstrated smooth gait with appropriate arm swings, proprioception and balance are intact, no evidence of cerebellar dysfunction. All right, that concludes our head to toe. You can lie down now. Bed is already lowered. I'm going to raise the side rails, give you the call light. And thank you for your time. You can conduct hand hygiene, gather my equipment, and go. All right, thank you.